So how do we diagnose fibromyalgia syndrome? Well, previously fibromyalgia syndrome was diagnosed based on trigger points, and trigger points are known as small bands of muscle which are painful on palpation. It used to be said that you need to have a minimum of 11 out of 18 trigger points in specific anatomical locations. The problem with diagnosing fibromyalgia syndrome using trigger points is that it is actually difficult to standardize the diagnosis between different physicians. So even though you have a body chart and you say, okay, there are 18 points that we're going to have a look at, the standardization says that you should use pressure of approximately 5 kilograms on the trigger point to see if that is a positive or negative. Now, trying to get 5 kilograms in between different physicians doing the examination is in fact quite difficult. Nowadays, we tend not to rely on trigger point counting, but we use the ACR, which is the American College of Rheumatology diagnostic criteria for a diagnosis of fibromyalgia syndrome. Now, this is a completely questionnaire-based system. It literally takes a few minutes, and when you see a patient who you suspect may have fibromyalgia syndrome, or if you want to firm up the diagnosis, this is an excellent and simple tool that we use. The ACR diagnostic criteria starts off with the locations that the patient complains of pain, and this starts off with a body map from head to toe, and you're actually able to count up the number of areas specified that the patient complains of pain. You also look at other what we call domains beyond pain. So we look at fatigue, sleep disturbance, and cognitive disturbance. And the patients rate this disturbance from 0 being no interference to the maximum of 3 being very severely disturbed. And there is a third part to the questionnaire, which is we look at a lot of associated symptoms. And this could include feeling dizzy, tired, vomiting, Raynaud's syndrome, headaches, bright lights, nausea, tinnitus, constipation, etc., etc. And then we score the number of those extra symptoms that a patient has. Once you've finished the questionnaire, you add up all the numbers, and then there is information at the end of the questionnaire which allows you to make the diagnosis or not of fibromyalgia syndrome. The American College of Rheumatology diagnostic criteria represents a very elegant way to diagnose patients who have fibromyalgia syndrome.